Hello, everyone, and good morning. My name is Maria Town. I'm the president and CEO at the American Association of People with Disabilities. Thank you so much for joining us. Apologize for the slightly late start. We had some technical difficulties, but everything seems to be working. So I'm going to pass it to Rashita Singh from AAPD to open us up with some housekeeping before we get into the content of today's webinar.
Hello, everyone. I'm so glad to see so many people here. My name is Rashita Singh. I am the Senior Policy Associate at the American Association of People with Disabilities, and I use she, her pronouns. For a quick visual description, I am a brown-skinned Indian woman with a black and white top. It's kind of looks a little bit leopard printy. And I have my hair in a blonde bun. It's dark brown hair with a cream colored headband and tortoiseshell glasses. So today we are here to discuss, it's our Strengthening Disability Rights webinar, and we're here to discuss HHS's new 1557 and Section 504 rules. So thank you for joining us. We're really excited about these rules. They come after decades of advocacy from, uh, advocates around the country, from allies, from disability rights advocates. And so we're really excited to talk more about these rules and to learn more about the details and what advocates can do to help implement more and enforce more. So just a little bit of housekeeping. As you can see, Maria has put in the chat the stream text link for anyone that would like to use that. We also have Gordon, who is our ASL interpreter and captioning. The event is being recorded, and then we will be putting it up on our channel later, and we'll be sending it out to whoever has registered. Also for the chat, please only use that for technical questions or anything regarding any technical difficulties. For Q&A, we will be collecting those questions through the Q&A feature, and then we'll be asking those questions at the end during our audience Q&A section. So thank you for joining us. Stay tuned, and I'm going to pass it back to Maria to go ahead and get this started.
Thank you so much, Rashita. And thank you for all your work in organizing this webinar. Again, everyone, my name is Maria Town. I serve as the president and CEO at the American Association of People with Disabilities. My pronouns are she, her, hers, and I'm a white woman with long brown hair. I'm wearing a black and white polka dot top, pearls, and bright red lipstick. And I'm very excited to be joined by the Director of the U.S. Department of Health and Human Services, Office of Civil Rights, Melanie Fontes Rainer. Melanie, we are thrilled that you're here with us this morning to talk about these really incredible rules, the updates to Section 504 and to 1557, and I'm excited to get to ask you a few questions. But first, I wanted you to introduce yourself to all of the advocates that we have on this webinar.
Sure, and my apologies in advance. I seem to have gotten, I don't know if it's allergies or something, but I'm a little hoarse, so I'm drinking tea. But my name is Melanie Fontes Rainer. I am the director of the HHS Office for Civil Rights at the U.S. Department of Health and Human Services. My pronouns are she, her, ella. As a brief description, I'm a Mexican-American woman with light skin. I have very dark, curly, it's wavy hair. I'm wearing a green tweed jacket today, and my hair is down. And excited to be here. For those of you that don't know, our office is the Civil Rights Office at the U.S. Department of Health and Human Services. We have offices in 11 cities across the country. In addition to federal civil rights laws, we enforce federal privacy laws under HIPAA and the HITECH Act. And we're really excited to be able to work with AAPD and have this conversation today. Thanks.
Well, thank you again for being here, and thanks to your leadership and the work of everyone in your department and the work of so many people at Health and Human Services. We have an updated Section 504 rule that prohibits disability discrimination in healthcare settings, and this is the first update that this rule has had since it was finalized in 1977. And as Secretary Becerra mentioned when he announced this rulemaking, healthcare has changed so much in 50 years. He brought out a red dial tone phone to illustrate that point. And so what can we expect from this final rule and all of the updates that it made?
Yeah, of course. And I'd be remiss if I didn't just piggyback up what you just said. This was a priority of this administration from day one. That didn't happen by accident. That's the product of advocates, parents, kids, families, individuals all across the country advocating for updates to these rules. So I like to start to just say thank you for continuing to hold us accountable and continuing to raise these important issues. So yeah, of course, Section 504 is such an important rule. And, we at the department are really excited that we have a final rule that will go into effect. This final rule prohibits discrimination on the basis of disability in any program or activity that receives federal financial assistance at HHS. So we issued the final rule. It modernizes, as you said, Maria, many places where the law has been updated in the past 50 years, right? The Americans with Disabilities Act, the Affordable Care Act, things like that, mainly in Olstead. The rule itself will do things like advances equitable health outcomes for people with disabilities, addressing very clear standards to address discrimination. We know, for example, a lot of these things, we continue to enforce them, but having clearer rules will help hospitals and others, sorry, I just spilled my tea, hospitals and others across the country to actually do better in this space, and for advocates and others to have something strong to hold up to say, this is what the law affords me, and here is what you need to do. So in that space, we know the rule strengthens and clarifies protections for disabilities in things like medical treatment, making sure that we have accessible medical equipment, making sure, I don't have to tell this group, right? Things like scales and tables that are accessible for people that have wheelchairs, making sure that medical decisions are based off of medicine and science and not bias or judgment of a provider, where someone might think just because you have a disability, your life is worth less. And we saw a lot of that during COVID-19. This is our learning opportunity to correct those things, because COVID really, I think, put a floodlight on these things. Making sure that we now have an enforceable standard for web accessibility, mobile applications, things like kiosks. When was the last time you went to a lab or an ER and you actually talked to a person, and you're oftentimes given a very tiny kiosk that you have to sign in on, and for many people that's not accessible. Making sure that, like in the child welfare space, that we're being clear about the requirements in this space, requiring that individuals get the care and services in the most integrated setting as appropriate, things like that. And so those are just a couple of the things in these rules that we're excited about.
Just small things, no big deal. And Director, I think we could change the name of this webinar to Spilling the Tea on 504 and 1557, and it will all be intentional. So you mentioned actually the child welfare system, and I wanted to talk about that a little bit, because I think when we think of healthcare, we often don't think of the child welfare system, and people with disabilities who are parents or who wish to become parents have often had to fight to keep their children or to be approved to become adoptive parents. How will the new Section 504 regulations change and shift these barriers to ensure that disabled people receive the supports they need in order to be the best parents they can be?
Yeah. So, children, parents, caregivers, foster parents, prospective parents with disabilities, may and often do encounter discrimination in the child welfare system, which is designed to protect children and strengthen families. And this final rule very clearly lays out that Section 504 of the Rehabilitation Act and these rules apply to child welfare programs and prohibit discrimination on the basis of disability in federally funded child welfare programs. This includes decisions about speculation, stereotypes, or generalizations about a child or a parent with a disability. We, from our own enforcement work, know that there are human services programs out there that inherently discriminate against parents with disabilities, right? It might not place a child with a parent with a disability, excluding the opportunity for that child merely because the person has a disability. May choose to separate a family because a parent has a disability. And those are things that we're trying to be very clear in this space, because based on our enforcement and what we've seen in the community, we know this needs to be very clear. We had a settlement agreement last year with Pennsylvania where their human services agency was excluding parents with disabilities from foster programs. Again, as you said, Maria, these are not hypotheticals. These are things that are actually happening across the country, which is why we thought it was really important to be super clear in the rule. Again, so that whether it's a human services agency or otherwise, they can take steps to address this preemptively so that we don't have to have OCR investigate something, or somebody doesn't have to first be discriminated against before they're able to be availed of their rights.
So we have already gotten some fantastic questions in the Q&A, and many of them I think relate to this next question. So how will Health and Human Services and the Office of Civil Rights enforce these new rules? And what can advocates do to further strengthen that implementation and enforcement? I will add, what kinds of training materials and resources are going to be generated or already exist to ensure that healthcare providers and others who are covered by this rule understand these new obligations?
Yeah, it's a great question. And I think something we've been thinking a lot about, right? These pre-existing rules have been on the books for a long time. So it's been a long time since a lot of these covered entities have had to learn or adjust or sort of prioritize how they are handling these provisions and compliance with these provisions. And that shouldn't be the case, right? Because they should already be doing many of these things, but we know it's not the case. And so the final rule will take effect July 8th of 2024 with some specific provisions related to web content and mobile apps and medical diagnostic equipment where there's separate requirements. OCR will be doing regional webinars across the country in each one of the HHS regions with our regional partners. So we're happy to make sure AAPD has that information and can send that out with its members. We are working on a toolkit for stakeholders that will be a truncated slide deck, a shorter, more sort of styled know your rights fact sheet for patients and individuals and family caregivers. As well. And we're working on a more in-depth section by section about the rule, which we got specific feedback people wanted to see. In addition to that, we did a webinar just earlier this week with ACL, the Administration for Community Living, with Allison Barkoff. We'll be doing another one of these with them on 1557. We'll be joining a couple of CMS things. We'll be joining other organizations. So we're trying to get out there as much as possible because, again, it's in our interest, and I think everyone's interest, to have as much transparency and education as possible about the new rule to help make sure that people are compliant. And if folks think about like, oh, we have a local convening or a webinar or some sort of meeting that might be helpful for OCR to come present, let us know. I can have one of my staff put an email in the chat box. We have staff all around the country. We want to be out in community talking about this. If you think, hey, all those things you talked about are great, Melanie, but like you're missing X, or maybe if you did Y, if it's something we can do, we will do it. So we're a pretty small organization. So we're really trying to leverage other parts of the department here, try to work with our community partners and have as much resources and content as possible so that our community partners can also be champions for this rule and make sure that it's followed.
So one of the things that I'm really excited about as someone who's directly impacted by this is the fact that, you know, doctors' offices will have to have accessible exam tables within 2 years of the rules implementation. So that's July of 2027, I think. So if I go into a doctor's office when I'm finally able to be seen, and there is not an accessible exam table, should I report it to OCR?
Yes.
Okay.
I mean, so like, I will say two things. One, hopefully that doesn't happen and all of the notices and things are updated. But two, if it does happen, yes, you should report it to OCR. And if you feel like, oh, I don't really want to do that, I'm nervous, or that's not my thing, you can also tell a community organization like AAPD or even any sort of local partner, and they can also tell OCR, which oftentimes is how we get complaints on the ground, because a lot of times individuals, you know, certain communities don't want to be the ones that file a complaint, even though they're the ones on the receiving end of a potential violation. But absolutely, yes. And if our website for filing a complaint is hhs.gov/OCR.
Thank you so much. I want to shift to 1557. And again, we've got so many questions coming in, so I really hope we have time to get to those. Similar to what we did with 504, can you talk about generally what 1557 is about and how it will impact the disability community?
Yeah, of course. So we at OCR like to think of 1557 as sort of like the kitchen sink of civil rights authorities here at the department, because literally the statute says non-discrimination in health programs and activities, which is pretty broad. And it's applicable across all the protected classes. So age, race, national origin, sex, disability. And within those spaces, it has very specific parameters set out for that. And as a lot of folks know, the previous administration had scaled back some of the provisions and applicability. So for example, in the disability space, we have not been able to do a lot of insurance work in this space because 504 doesn't apply to insurance, but 1557 does. But because the previous administration had basically taken out that private insurance component outside of Medicare and Medicaid, we didn't have the ability to do so. So like complaints where someone's saying the font isn't big enough on this bill, or my provider is unwilling to accommodate an auxiliary aid or whatnot, we weren't able to take steps. Now with this final rule, we will be able to do that because we've restored the scope in the insurance context, but we've also allowed for that in the disability context. This rule, as many folks knows, is for the first time counting Medicare Part B as federal financial assistance, which sounds super wonky and very DC, but for like people out there, right? It matters because it means that my office, the federal government, will have another hook by which people will have to follow federal civil rights laws. And Medicare Part B, right, is hospitals. And so that's a really important component of our healthcare system. And so we're excited about that, doing that for the first time. And you know, I think we got no negative comments on that. And so that's good, right? I think that means the industry is there too. The final rule requires covered entities, so whether it's a grantee or a health plan or a Medicaid agency, to provide appropriate auxiliary aids and services where necessary to afford individuals an equal opportunity to participate and enjoy the benefits of health program and activity in question. Such auxiliary aids must be provided free of charge, in accessible formats, in a timely manner, and in a way that protects the privacy and independence of the individual with the disability. The final rule also takes steps to ensure communications with individuals with disabilities, including companions with disabilities, are as effective as communications for those without disabilities in health programs and activities. Covered entities must also implement written procedures for effective communications, written procedures making reasonable modifications to policies, practices, and procedures. The rule, I mean, those are specific to the population for disability. The rule also, right, restores sex-based discrimination. So discrimination on the basis of sex, which is inclusive, right, and consistent with the United States Supreme Court and United States decision in Bostock. So sexual orientation, gender identity, inclusive of intersex and sex characteristics, as well as pregnancy and pregnancy-related conditions. The rule restores language access provisions, making sure that things like languages are translated into, or documents are translated into the top 15 languages, requiring training, requiring coordination. So we're really excited about the rule. A lot more to come from us on this, and hopefully you don't get OCR fatigue from all these rules, but we'll look forward to working with everyone.
I'm excited to have the potential of OCR fatigue when the rulemaking is something that I think is so positive. You actually just kind of answered my next question, but I think it's really important to note that the disability community is incredibly diverse, right? Disabled people exist in every single community, and disabled people are more likely to be LGBTQIA, are more likely to be trans specifically. And so if you did want to spend any more time just going through all, other highlights of 1557, we would welcome that.
Yeah, of course. And, it's, of course, like no person is just one thing, and we're at the intersection of our civil rights, right? And you and I, Maria, are not just women, right? We're women who have various characteristics and parts of our personhood that might affect how we interact with the health and human services systems. And so it's a really important part of our work to think about that intersectionality. And we think about that in our enforcement, right? We're not just looking for one thing. If we're looking for one thing and we see something else, we're going to act upon it. But yeah, the rule itself talks about and has provisions related to equal treatment for all. So specific to gender affirming care, does talk about what that means, and that you can't have categorical denials of care, and sets a de minimis standard of harm as that threshold. The rule also has health benefit design provision to require and make sure that health benefit design isn't discriminatory in any aspect, whether it's on the basis of sex, age, race, etc. But also does talk about categorical denials in the space of gender affirming care for LGBTQI population. And we think those are really important provisions to have. We're being sued on them already, but we think it's really important for the federal government to be very clear about these things.
So one other question that I had about 1557 is in the context of conscience rights, and religiously affiliated institutions have often used conscience rights to deny care, healthcare, employment, education, and other rights to people with disabilities. Many folks were confused about 1557, the rule's repeated emphasis on conscious rights. And so can you clarify how the rule ensures patients are free from discrimination based on providers' religious beliefs?
Yeah, it's a good point, and one I think, I'm helpful to talk about. I mean, the bottom line is the law hasn't changed. So in the same way that we have Section 1557, which requires non-discrimination health programs and activities, all of the conscience statutes that are applicable to HHS, which there are many across a range of healthcare services, including federal law, the Religious Restoration Freedom Act, those things continue to apply. What the rule was trying to do is be very clear that these two things can coexist and do coexist. And unlike, I think, some like to push this narrative that it's a one or it's a nothing proposition. And I don't think that's accurate, right? We are a law enforcement agency and we enforce these laws. And so the rule meant to be very clear that there are religious and conscience protections on the books. OCR works to drive compliance with these across all of its programs and services here at the department, and to enforce those legal obligations, and therefore under that, that's what that means. the rule did go very in depth about what that means, in part because we're trying to be as clear as possible in response to some of the religious comments we received that we weren't as clear as we could have been, or it wasn't as clear. And so, making sure that recipients of federal financial assistance can and know that they can rely on applicable federal protections for conscience and religion. We have an exemption process now when those are raised, being very clear about what happens in the enforcement process. We separately have a separate conscience rule that goes very in depth into that enforcement process. So I would say in this space, it's really important to be clear because, as you know, there could be possible discrimination. But also we find that in being clearer here, we get to be very transparent about how we will handle these and how we think covered entities should handle these so that there's no ambiguity and that we can make what decisions are best for covered entities and what decisions are best for patients.
Thank you. And this is my last prepared question, and then we can go to the audience Q&A. So the 25th anniversary of the Olstead decision is less than a month away, which is really exciting. Can you tell us how the Olstead decision's integration mandate is incorporated into both 504 and 1557?
Yeah, of course. And I don't know if folks know, we at OCR recently launched an Olmstead initiative here, led by Robin Sue Ferbosi, who is a national expert in this space. And so we did that to try to drive attention to these cases because we were seeing an increase in these cases nationwide. So folks know that Title II of the Americans with Disabilities Act, Section 504 of the Rehabilitation Act, and the Supreme Court's ruling in Olmstead require state and local governments to make services available to people with disabilities in the most integrated setting appropriate to their needs. Enforcement of Title II of the ADA and Section 504 and the integration mandate of Olmstead decision is a priority for the department. The new 504 rule strengthens these requirements by adding details about what it means, including a definition for the most integrated setting, which is really important and consistent with case law. And Section 1557 of the Affordable Care Act finalized new provisions in its non-discrimination requirements for insurance that expressly prohibits insurers from having or implementing benefit designs that don't provide or administer health insurance coverage in the most integrated setting appropriate to the needs of individuals with disabilities, including practices that result in serious risk of institutionalization or segregation. Folks might be familiar, just a few weeks ago, we had a major Olmstead action that was announced, before these rules were finalized with the U.S. Attorney in Rhode Island, where we issued a letter of finding to the state of Rhode Island because kids were being unnecessarily placed in a hospital setting for weeks, days, even up to a year, when in some cases they shouldn't have been there at all, or it should have been a pit stop. And the state, in fact, wasn't triaging those cases well, wasn't sending the kids to the right places. And in often places, there wasn't a lot of discharge planning for those kids. And so, again, these are important issues. And as many folks on this call know, they're emerging issues we're seeing across the country, and over-institutionalization of kids across the country with serious behavioral health and mental health issues. And so it's something that the office has prioritized to try to make sure that we're deterring that. And I think more to come in this area, but we're really excited about the anniversary because we have a lot to show right now in this space.
Thank you again. So now I'm going to go to our audience questions. One of the questions we got was, could you help us understand if the government officials involved in crafting these rules have lived experiences with disabilities and specifically visual impairments or blindness?
Yes, we do have members of our teams that do have disabilities. And I worked on these roles, and actually my mom lives with me and she has visual impairment. She's blind in one eye and has partial vision in her other eye. So yes, very much we did have that representation, and we thought about it a lot in terms of how they might be affected in these rules.
The next question relates to kiosks. Christina writes, in regards to kiosks, do the requirements impact anyone that receives funding under Section 504 or just Health and Human Services? We weren't clear as a public university receiving funding under Section 504 if that aspect was only related to health and human services organizations.
So our standard models is after the accessibility board standard, which is WCAG. I think it's 2.0, but don't quote me. And so it's consistent. And so my specific jurisdiction, meaning where I can take complaints, where I might be able to issue a letter of violation or take corrective action, I am limited to when a covered entity has funding from HHS. So that's a lot, right? HHS is a very big agency, so that could be Medicaid, Medicare, which are huge funding sources for many hospitals across the country. And sometimes OCR does also get funding through non-health. We have non-health Title IX jurisdiction. So it just depends. And, you know, we do have a lot of different funding sources. If it was just purely an educational program or activity, probably we wouldn't have jurisdiction. But that is one of the first questions that our investigators will suss through when they open up an investigation, is to determine the funding source of the jurisdiction in the first instance.
And one thing that I think is important to note here is that there are new web accessibility guidelines for Title II entities, or ADA Title II entities, which can include public universities and state universities. So you may actually have new web and kiosk accessibility obligations under that new rule. There have been a lot of very important, significant rulemakings related to disability, accessibility, and equity from both Health and Human Services and the Department of Justice in the past month, really. So Bill asks, do the updates address or prohibit the use of discriminatory metrics such as QALYs, quality adjusted life years, in determining the value of treatments?
Yeah, it's a good question, something I should have flagged in my remarks. So the rule itself does not prohibit QALYs or other value assessment methods. However, the reg text itself explicitly prohibits them when they're used in a discriminatory manner, which is something that we thought was really important given our enforcement space. So I would say the answer to that is yes, the rule does address that very specifically and head on, and we think it's really important.
I just want to voice, Sonia has said that the work and the clarity within this rule is so important. As a disabled person who hopes to become a foster parent one day, I'm full of hope hearing this. So Melanie, thank you for giving us hope today. Amira asked a question about rule implementation timelines, which I know you've already spoken to previously, but if you wanted to say more, I think we would welcome that.
So most of the provisions take effect July 8th. The specific ones as to web accessibility, kiosks, accessible medical equipment, those have different timeframes. And so they'll be sort of on a rolling basis.
Bruce asks, will HHS partner more with the Department of Justice to do more active enforcement concerning healthcare and disability civil rights?
Yes.
I love a straightforward answer. We have an anonymous question that asks, does Section 504, Section 1557 apply to dental offices where there is no accessible dental chairs and staff will not assist people with disabilities?
So I think that would depend upon the funding source. I'm not an expert in funding sources for dentists, but I don't think they always get Medicare and Medicaid funding, and I'm not sure they get other HHS funding. I think it would depend on the funding source, and then depending upon that, perhaps.
Yeah, I'm actually so glad someone asked that question because, you know, dental and vision can fall into these different categories that really prevent a lot of people from getting coverage. So I'm very grateful to the person who asked that. Ashley says, I work at a medical school. Will this policy extend to universities as well? Do they count as healthcare, human services settings?
Yeah, so the U.S. Department of Education's Office for Civil Rights also has a 504 rule that is separate and apart from ours, where they get squarely to education. So they would likely have jurisdiction. For universities, we would have jurisdiction over certain programs and activities, because like I said, for example, a university hospital system, a residency training program, we would have jurisdiction in many of those cases. But like blanketly across the university, I think it would depend, and probably not all of it.
Van says, as a physician entrepreneur who is legally blind, I can personally tell you, I don't get health care because of poor wayfinding inside healthcare facilities. Will these rule changes also encourage funding for innovation and indoor wayfinding so that people with disabilities can get to appointments on time without reducing operational efficiency?
Sorry, you made me emotional, Van. So yes and no. So one, thank you for sharing that. Again, my mom lives with me, and I am her primary caretaker. And so I go take her to appointments. And every time I do, she says, what do people do that don't have a you? And it really tugs at my heart, because basic things can be very challenging, and that other facilities or doctor practices or whatnot, they don't think about that, right? And so sometimes when my mom goes, if there's not someone in the waiting room that will help her, or not someone that might help guide her, then yeah, you're right. She might be late to an appointment. She might miss her Metro Access van. They might leave her, which has happened to her, in the couple of times when I haven't been able to take her, which is very frustrating. The rule itself doesn't have funding. We're not a funding jurisdiction. We do work with organizations within the department that do. I think that's something we can take back to our partners at the agency and figure out other ways to do that. But thank you for raising it. And I do think, the parts of the rule where it's, the kiosk, or it's even thinking about accessibility, entering the facility, I think we can think about those more too.
Sheila asks if the rules cover blood draw practices.
If they get federal funds, yes.
And I'll ask this question myself. How should someone know if a hospital or other healthcare setting or human services setting gets federal funds?
I mean, you don't usually know that, right? I mean, typically what is required under 1557 and 504, but mainly 1557, is when you walk into a provider, they will have a notice of non-discrimination laws up in the, I'm sure you've seen them in an emergency room or in a clinic. They're posted very broadly, and they tell you if you think you've been subjected to discrimination, where to file a complaint. Sometimes it just has the Department of Justice, sometimes it has HHS, sometimes it has a state agency. So that might be one tell for you to determine. Alternatively, there are websites at HHS where you can look, but typically I don't think it's that easy to determine. I mean, outside of Medicare and Medicaid, where that's pretty straightforward, I'm not sure it's that easy to determine.
But I actually think that's an important point. If you are someone who, uses Medicaid or Medicare to cover your healthcare needs, that is federal funding. So if you're going somewhere that takes Medicaid or Medicare, that hospital, that doctor's office, that healthcare setting or human services setting takes federal funding and would be covered by these rules. So Joyce asked two questions, and I'm going to combine them. Will these rules cover power doors or automatic doors? Because oftentimes people with disabilities cannot get into offices easily. And what does this mean for sign language interpreters? Or is every hospital going to have a sign language interpreter now?
I don't know the answer to the question on power. My suspicion is it's not covered because it's medical accessible equipment. So things like chairs, scales, things like that. But I don't definitively know that. So I will follow up, and then Maria can chat that back. So if that person could email Deborah, that would be helpful.
Okay. Hector says, hola, Melanie and Maria. Here in Los Angeles County, we are not allowed to share this information, HHS, with consumers of Los Angeles County Department of Mental Health. How can we get this information and resources for our siblings with psychiatric disabilities in LA County Department of Mental Health so we can help with learning about this new legal update. So I think to summarize, and Hector, let me know if I've got this correct, how can advocates like Hector share this information with people who are in a psychiatric treatment setting so that they can know what their rights are?
Yeah, so I would say two things. One, we will send out our toolkit when it's available to Maria so that Maria can share with this entire organization list. It would also be posted on the OCR website. You're also able to sign up for OCR's listserv. If you go to hhs.gov/OCR, you have the option to sign up for our HIPAA website or HIPAA listserv or our civil rights listserv. Either way, that's where most of our information gets sent out, broadly disseminated to individuals. And then second, I would say, if there is an opportunity for us to do something in community, reach out to Deborah and we'll follow up.
Someone asks, do the rules regarding accessible exam tables, etc., apply to individual medical offices like solo practitioners or only large hospital settings?
The provisions on tables and scales is applicable across covered entities. When it gets to more specific medical equipment, that varies depending upon the specialization in the role.
And kind of related to this, Alexandria asks, so does this mean we have the right to have things printed in larger fonts and ask for accommodations for wheelchairs in non-accessible doctor's office immediately, or do we have to wait until the phase out ends?
Yes, the new rule is out. It takes effect soon. Many of those provisions will go into effect immediately, but others won't, and so it will just sort of take time. But I will say this, we are thinking of mechanisms to, for example, we might think about sending a letter to healthcare providers and states and cities and counties saying, hey, these new rules are coming up. These are all the things you're going to have to do to be accessible for people with disabilities. Start getting ready now. And we hope that that will have the effect of just changes in practices instantly, but it might not immediately.
And those are things that advocates could do too, right? Bob asks, in Olmstead, the court relied that when termed unjustified isolation violates the Americans with Disabilities Act in Section 504. People with disabilities are unjustly isolated in both in institutional as well as in community. For example, people with little to no understandable speech who are denied access to effective communication tools, support experiencing extreme isolation and marginalization in all settings. How will the Office of Civil Rights address this? Bob Williams from Communication First.
Yeah, so we talked a bit about the Olmstead provisions, both across 1557 and 504 and our Olmstead. We do have a strike team that is now just focused on Olmstead complaints, and they're doing a lot of, the office calls it like faster relief, where it's not maybe a big settlement or a big violation. It's just helping one individual in a one-off case. We are doing a lot of that. And then, you know, a lot of these things are intersectional. And again, we know that some of these things have been inapplicable. For example, you have a right to have a companion with you. We know, especially during COVID and the public health emergency, a lot of people didn't follow that. And so people were denied that companion. That is something that is required in all healthcare settings as part of these rules. Before the new rules take effect, that should be required. And so that's another way in which we're enforcing. And so if there are cases you think that are happening of that, you know, please feel free to reach out to us and let us know, because we're happy to start to take, because sometimes just us asking questions is enough to instill change in many instances.
And a part of Bob's question, a significant part of Bob's question, is not only focused on Olmstead and community integration, but also on effective communication and kind of a right to communication. So can you say more about that as well?
Yeah, I mean, the 504 rule and 1557 make clear that you do have a right to effective communication. That can be things like accommodations that are necessary to help you. including the companion piece, which for a lot of people might be helpful in that space. So again, that's already the case. So if you're seeing these kinds of cases pop up, I think those are ones in which you might want to give us a call or file something so we can take a look.
Someone asks, a major factor that prevents me from going to hospitals and doctors' offices is indoor air quality. Filled with sins and chemicals of all kinds, the insult to my respiratory system, nervous system, and digestive system is disabling. What is HHS doing about the environmental air quality issues in medical buildings? And is that something that's a factor in either 1557 or 504?
Yeah, I'm not sure I'm the right person to answer that. We do have an Office of Climate Change and Environmental Protection at HHS that Secretary Becerra did start at the beginning of this administration. So that's something I'm happy to take back to them, but it's not something in my knowledge or things that we're addressing in these rules.
Well, I think that was actually our last question. We really appreciate you spending so much time with us this morning. We did have a number of other questions, and what we can do is actually make sure that we've captured all of these and send them to your teams in case it's helpful as you're creating resources and explainers and various trainings. And we can also send out the materials that you've mentioned and contact information for your team that you referenced in this webinar. So thank you again for all of your time and your leadership. As you can tell, there is a lot of excitement and interest in these two rules.
Thank you so much for having us, and thank you for giving me the time to speak with you all today. We appreciate it.
And thank you everyone for joining today's webinar. As I mentioned, we will send the recording out to everyone who registered, including those who could not make it. We will also send out any materials that currently exist that were referenced on this call, as well as information about filing an OCR complaint and connections with OCR staff who might also want to engage you in any events or education efforts that you are doing around 504, 1557, or health equity for people with disabilities. Thank you so much.